This is Barry Zalma, Zalma on Insurance for YouTube. I am an attorney who's decided to retire from the practice of law. I now spend my time as an insurance claims consultant, insurance expert witness, and as an author of books and materials. From Zalma's insurance fraud letter that will be issued next on April the 1st, we need to speak about insurance fraud and convictions of insurance fraud perpetrators. No one really knows how much is taken from the insurance industry and the government insurance programs like Medicare and Medicaid. But the best estimates show that the amount ranges anywhere from about $80 billion a year to about $300 billion a year or more. Some doctors, especially as they get older, have decided that insurance fraud and defrauding the governmental medical programs is a great way to fund their retirement. Are finding that the government doesn't like that, and that the government has begun investigating, prosecuting, and convicting those involved in Medicare or Medicaid fraud. So today we're going to talk about some of the convictions reported by the Department of Justice and the Department of Health and Human Services, who have investigated and convicted various medical practitioners involved in health insurance fraud. The first involves a doctor who pleaded guilty to healthcare fraud for providing goodie bags and agreed to resolve civil fraud and controlled substance liability for $2.8 million. The Department of Justice reported that Andrew M Berkowitz MD of Huntington Valley, Pennsylvania, was sued by U.S. Attorney William M McSwain, who announced that the United States filed a civil lawsuit against him for engaging in healthcare fraud and improperly distributing and dispensing controlled substances. The civil complaint related to criminal charges that were previously filed against Berkowitz and for which he has pleaded guilty. At the same time the new civil suit was filed, the United States also filed a proposed civil judgment in which Berkowitz agreed to pay a total of $2.8 million in civil damages and penalties under the False Claims Act, Controlled Substances Act, and in civil forfeiture committed to never obtaining another controlled substance registration, and consented to a 20-year exclusion from Medicare and Medicaid. The consent judgment remains subject to court approval. The civil lawsuit alleged that Berkowitz, through his healthcare practice and employees, developed a scheme where his business dispensed prescription drugs, including controlled substances, to patients in what the staff referred to as goodie bags. Berkowitz allegedly dispensed the drugs to every patient whose insurance would cover the drugs he had in stock. The suit alleged that Berkowitz dispensed the drugs for profit without any meaningful assessment of medical necessity or whether the drugs had a legitimate medical purpose. For each goodie bag dispensed, Berkowitz allegedly submitted claims for reimbursement, falsely asserting that the drugs were medically necessary for the patient. Berkowitz also allegedly prescribed oxycodone to pill-seeking patients in exchange for submitting excessive claims to patients' insurance, including Medicare, for medically unnecessary prescription drugs and for services not rendered. The complaint noted that Berkowitz pleaded guilty to criminal charges in January of 2020 and admitted to these facts in court. Berkowitz agreed to resolve this civil liability under terms outlined in the proposed consent judgment if accepted by the court. Among other things, Berkowitz would pay $2.8 million in civil damages and penalties under the False Claims Act, in addition to the $3.5 million he had already agreed to pay in criminal restitution. The proposed resolution would also permanently prevent Berkowitz from prescribing, distributing, or dispensing any controlled substances in the future. The civil complaint relates to the criminal charges that were previously filed against Berkowitz. On June 25, 2019, a federal grand jury returned an indictment charging Berkowitz with health care fraud and distribution of controlled substances outside the usual course of professional practice and without a legitimate medical purpose. On January 24, 2020, Berkowitz pleaded guilty to all charges before the Honorable Paul S. Diamond, describing Berkowitz as a drug dealer who committed prolonged and outrageous dishonesty and fraud. Judge Diamond revoked bail and remanded him to the custody of the United States Marshal pending sentencing. The case was investigated by the FBI, the Philadelphia Police Department, the U.S. Department of Health and Human Services, and other investigative agencies. The only question I have is, how much money did Dr. Berkowitz really make if he is able to pay over $5 million to the government as part of the settlement and restitution for the criminal case? I would expect the judge will assign a long prison sentence to the good doctor. In another case, a village's dermatologist agreed to pay more than $1.7 million to settle a False Claims Act liability for inflated medical claims. Dr. T. Tien Nguyen Tran and Village Dermatology and Cosmetic Surgery, LLC, agreed to pay the United States $1.744 million to resolve allegations that they violated the False Claims Act by submitting inflated claims to Medicare for wound repairs related to MOHS, that's MOHS surgery. The settlement relates to Dr. Tran's submission of claims for adjacent tissue transfers performed by Village Dermatology. Dr. Tran and the Village Dermatology unit performed wound repairs that were allegedly billed to Medicare as more complex adjacent tissue transfers, which carry a higher level of reimbursement. According to the settlement agreement, from January 1, 2011 until July 31, 2016, Dr. Tran and Village Dermatology billed for 14,000 level tissue transfers, which should have been billed as lower-level wound repairs. These submissions resulted in inflated claims that were paid by Medicare. The settlement concluded a lawsuit originally filed in the U.S. District Court for the Middle District of Florida by Dr. Robert Green and Emily Kennedy. Dr. Green and Ms. Kennedy sued under the QI-TAM, or whistleblower provisions of the False Claims Act, permitting a private citizen to sue on behalf of the United States for false claims and share in the recovery. The settlement resulted from a coordinated effort by the United States Attorney for the Middle District of Florida and other federal units. In a third case, a Pittsburgh resident pleaded guilty to conspiracy, healthcare fraud, and aggravated identity theft. Tameka Adams, 43, pleaded guilty before U.S. District Judge Kathy Bissoon in federal court to 1 count each of conspiracy to defraud the Pennsylvania Medicaid program, healthcare fraud, and aggravated identity theft. During her plea hearing, Adams admitted that at various times between 2011 and 2017, she was an employee of 3 related entities operating in the home health industry: Moriarty Consultants, Activity Daily, Living Services, and Everyday People Staffing, and a 4th entity, Coordination Care, Inc., all of whom were approved under the Pennsylvania Medicaid program to offer certain services to qualifying Medicaid recipients, including personal assistance services, service coordination, and non-medical transportation, among other services. Between in and around January of 2011 and April of 2017, these agencies collectively received more than $87 million in Medicaid payments based on claims submitted for home health services, with payments accounting for more than $80 million of the total amount from the state of Pennsylvania program. During that time, Adams admitted she participated in a wide-ranging conspiracy to defraud the Pennsylvania Medicaid program for the purpose of obtaining millions of dollars in illegal Medicaid payments through the submission of fraudulent claims for services that were never provided to the consumers identified on the claims, or for which there was insufficient or fabricated documentation to support the claims. As part of the conspiracy, Adams admitted that she fabricated timesheets to reflect the provisions of in-home care that in fact she never provided to the consumer identified on the timesheets. In one instance, Adams admitted submitting false timesheets claiming that she provided more than 80 hours of care in a single week to an attendant, while also working full-time as the nominal president of one of the companies dealing with Medicaid. Adams further admitted she caused the submission of Medicaid claims in the name of ghost employees for care that never occurred. Likewise, Adams admitted that she paid kickbacks to at least one consumer, her spouse at the time, in exchange for his participation in the scheme. Specifically, Adams admitted she and her father, co-defendant Tony Brown, used Brown's name on timesheets for fabricated care of Adams' spouse. At various times, Adams admitted that she, Tony Brown, and her spouse would meet at an office on the day that Brown received payment for the fraudulent care so that the 3 individuals could divide the proceeds. In total, Adams acknowledged causing losses to the Pennsylvania Medicaid program in excess of $250,000 related to her spouse alone. Adams also admitted that during the conspiracy she caused the submission of Medicaid claims that her friend, an MCI employee, purportedly provided to various consumers without the friend's knowledge, and when in fact no such care had been provided to any consumer. During this time, Adams admitted that her friend was recovering from a serious injury and unable to work. Adams further misused her friend's personally identifiable information to obtain and misappropriate the resulting salary payments. Finally, Adams admitted that during the course of audits, she fabricated documentation for submission to state authorities. The conspiracy and healthcare fraud charges each carry a total sentence of not more than 10 years in prison, a fine of $250,000, or both. The aggravated identity theft charges carry a mandatory sentence of 2 years in prison to run consecutively with any sentence imposed on any other charge, and a fine of no more than $250,000. Under the federal sentencing guidelines, the actual sentence imposed would be based upon the seriousness of the offense and the prior criminal history. To date, a total of 16 defendants have been charged in connection with this investigation, and Adams is the 12th defendant to enter a guilty plea. The remaining defendants are presumed to be innocent. My question, of course, is what took Pennsylvania and the federal government 6 years to catch on to this scheme? When you receive billings for more than a person could possibly provide, one would expect an investigation to start and not take 6 years to finish. Finally, a jury verdict resulted in recovery of more than $10.85 million to the Medicare program after a federal jury found defendants Ted and Julie Cain of Ocean Springs, Mississippi, guilty following a 9-week trial. The government's complaint and evidence at trial established that these defendants used Stone County Hospital, formerly a 25-bed critical access hospital and Medicare provider, to provide and to fraud Medicare of more than $10.85 million through fraudulent annual Medicare cost reports for the years 2004 through 2015. That means this crime succeeded for 11 years before the government got around to charging the Cains. The majority of the damages sustained by the government resulted from Ted Cain's multi-million-dollar compensation billed to Medicare through the Stone County Hospital and Corporate Management, Inc. Passed on the vast majority of Ted Cain's multi-million-dollar compensation to Stone County Hospital, which Medicare reimbursed for costs at 101%. From 2004 to 2013, and 99% from April 1, 2013 and through 2015, under special reimbursement principles for critical access hospitals that help rural, undeserved areas. So the government, trying to do good, opened up its pocketbook so that these people could steal and become rich without providing any help to those who were critically injured or ill. An audit conducted eventually by the Mississippi Division of Medicaid found that Corporate Management, Inc. self-disallowed home office costs on its Medicaid home office statement, but charged those costs to its Medicare home office statement. The jury made a number of findings in the verdict, resulting in recovery of more than $10.85 million to the Medicare program. Damages were trebled under the False Claims Act. The court also imposes a statutory penalty of $5,500 to $11,000 for each false claim for cost report years 2004 to 2014 and $11,181 to $22,363 for the 2015 cost report. Accordingly, the total amount of defendant's civil liability will be determined by the court using the jury's verdict. The jury verdict resolves a lawsuit that was filed by James Aldridge under the qui tam or whistleblower provision, which permit private individuals to sue on behalf of the government. The United States, therefore, appreciates the realtor's interest in a program, integrity, and his assistance with the successful outcome. The United States also appreciates, it says, the assistance of the Mississippi Division of Medicaid, who audited the program. I, as a citizen and taxpayer, appreciate the fact that a citizen needed to report this ongoing 11-year crime, and the government didn't even notice it until it happened. We must have better, more aggressive investigation into Medicaid and Medicare fraud. This video was adapted from the April 1, 2020 issue of Zalma's Insurance Fraud Letter, which is available free and published twice a month, every month for the last 24 years. You can subscribe at the link at my website, www.zalma.com. Thank you for your attention.